Well, let's move to some healthcare, sort of healthcare-related kinds of questions, because our viewers are concerned about that topic. Our viewer from Morris wants us to talk about home and community-based services, specifically day programs. Talks about a rate increase, not been a rate increase since July of 2014. Is concerned about a workforce crisis. Before we went on the air, we were also discussing issues with PCAs, personal care attendants. That's a problem. Let's start with you, Senator, and then we'll give Senator Lang a shot at it. So, talk to us about those issues.
We're at a point of almost having what I'd say is a collapsing system. I mean, we're struggling in homes around the state for them to stay open because they can't find people to work for the low wages we pay for this. And you know, I understand the frustration of throwing money at a problem. I don't think that's the solution. But I'll tell you what, it's going to be a moment when one of those folks gets injured or hurt, or someone passes away under negligent care, and then the state's going to be liable, because we're just simply not providing the resources necessary to take care of those folks. And I think that Senator Abeler and Senator Benson made a good faith effort, but their hands were tied by leadership. They just didn't get enough money to do what they need to do to have a raise in pay. And if we don't acknowledge that those folks are creating or managing really life important situations and the well-being of many people who have disabilities, that they deserve or need more pay, then we're not going to get across. We're not going to get across the finish line. We need to absolutely take that seriously, because if we don't provide them with the workers they need, it's not going to be successful, and people are going to suffer. And that's the problem we have. And so Jim Abeler, or Senator Abeler, and I think Senator Benson attempted to kind of address that, but their targets were too low, and there's really nothing they could do to invest in that. So it kind of leaves them off the table, and they went many years without a pay raise. We did the 5% thing in 13 and 14, and then now we're back to nothing again. And as time goes on, especially with some of the new waiver things coming up, it's going to get even worse as we disinvest in those things in 2019. And so it's a real crisis, and it's a crisis that I can't seem to give it enough oomph for people to pay attention, right? Because no one's out there advocating for the disabled folks like they are advocating for a lot of other groups. And that's what we need to be aware of, and we're just not creating that awareness statewide.
Senator Lang?
Yeah, I mean, I guess I can't disagree with anything he said. That, you know, with low targets, however you want to perceive that, it's a challenge, there's no doubt. You know, I guess my experience in healthcare industry is pretty lacking. I'll admit to that, and the experience that I do have has to do with specific locality stuff in Willmar. So we dealt with the child and adolescent behavior, the CABS. I think you remember seeing that bill come through. It's a small 16-bed facility in Willmar that deals with, you know, adolescents, and you know, and part of that is that was more behavioral health, but I know I'm getting off topic. But you know, and then we worked with the Pact for Families is another one that I had pushed through earlier this year that went well. You know, kind of down the same routes. But yeah, I mean, you do need to get good people. You have to pay them the right amount to provide the services they provide. I can't disagree with that. So.
And what happens, and actually Senator Lang brought a couple of good bills before the committee, and I was really impressed with what he had brought. That really addressed some important areas, but they were, you know, they're piecemeal, because each one worries about their area, which is our job, right? But my mother-in-law works in a home and helps people. And there is, if anybody's ever worked in this home, there's always usually one or two people who, like, this is their life and calling, and they are literally the glue that holds it together. And what happens is as we can begin to continue to parcel people away because we can't pay enough to get good help, their burden gets bigger and bigger and bigger, and before long they get burnt out and they can't do it anymore. And because we don't give them adequate supplies, we've been able to rely on those folks for way too long. And it just takes a matter of time before we're going to lose them too. And when we lose them too, we're going to be in a serious crisis here that we haven't seen since the Olmstead Act, or Olmstead Judgment. So we really got to, I think we have a chance to be proactive about it, and we're just really not taking the initiative this time to do it, especially with the $1.6 billion surplus. That's the part that kills me. Now, we may not agree on that, but I mean, that's huge.
And that's, you know, everything boils down to money ultimately, and that's what we're talking about. This is what I say every time is the state has a checkbook. The checkbook has a certain dollar in it. The 1.65, yeah, we spent a lot of that on health care coverage, or the reinsurance plan.
Which was a disaster to do that too.
And say whatever you want to about the reinsurance plan.
But if you look at the tax targets, right? The tax targets cut from Senator Chamberlain, while it sounds nice, right? The most it's ever going to result, the biggest version of that's going to be about a $2.45 increase per pay period for a person. That's the biggest their tax cut's going to see. So it's this giant tax cut over such a wide group of people that it gets watered down to be almost non-existent in your paycheck on a weekly basis. And so for me, if we're going to make targeted tax cuts, let's target the people that actually need it, and let's spend the money where we need to spend in our state. So I would disagree with the philosophy from the majority party in there. I don't think they're managing that very well, and I think you're going to go into conference and it's going to come back a completely different bill once the governor and them tangle on it.
That's why targets are targets.
So, well, we won't be able to resolve that, but I did want to give our viewers some understanding of what's going to be on the table and some of the discussion, and of course this issue of PCAs and so the home health care piece is going to be a part of that conversation as well.